Good morning, dear students. We are going to just discuss about the antihypertensives. Before starting that, we must know about the structure of heart. The heart is pumping the blood to the whole parts of the body. The reticular vessels which are arising from the heart, that are arteries that are supplying pure blood to the whole part of the body, and the blue color vessels are the veins that collects the impure blood from the whole part of the body. The right side of the heart is always contain the impure blood, and the left side of the heart contain the pure blood. The pure blood is pumped from the left atrium into the aorta. From aorta, the blood is passed through the blood vessels and it is collected by the veins and it is poured into the right atrium. So in this way, the blood is circulated in the heart. The major organs which affects the blood pressure, that includes the heart itself. Second organ, that is a liver. Third organ that affects is the lungs, and the fourth organ that affects the blood pressure, that is the adrenal gland present above the kidneys. So we know the blood pressure is nothing but the arterial blood pressure that we are just going to focus. The blood pressure is always measured by multiplying the cardiac output into the total peripheral resistance, and this is one of the very key point for understanding how the blood pressure is regulated. So we must know that the blood pressure is always regulated by the cardiac output and the total peripheral resistance. The blood pressure is a ratio of systolic blood pressure by diastolic blood pressure. The systolic blood pressure is nothing but the pressure in the arteries when the heart is contracting, and that is always more. And the diastolic blood pressure is nothing but the pressure in the blood vessels when the heart is in a relaxed condition. That is always less. The normal blood pressure is a 120 by 80 mm of Hg. When the blood pressure goes above 140 by 90, it is considered as a hypertension. And in order to treat the hypertension, we are going to use the different types of drugs. The drugs which lowers the blood pressure, we call them as antihypertensives, or the drugs which are used in the treatment of hypertension, we call them as antihypertensives. Clear? Antihypertensives can be remembered by remembering the alphabets A, B, C, D, E. The first A is indicating what your angiotensin ACE inhibitors. Second is indicating angiotensin receptor blockers. Third is indicating alpha 1 receptor blockers. So before starting that all, we must know about some basic things about the renin-angiotensin system. So the liver is secreting one kind of protein, we call them as angiotensinogen. When blood pressure goes below the normal, it gives signals to the kidneys. Kidneys are releasing one kind of enzyme, we call them as renin. The renin converts that angiotensinogen into angiotensin 1. When this angiotensin 1 goes into the blood, it reaches into the lungs. In the lungs, there is one enzyme called as ACE, angiotensin converting enzyme, that converts angiotensin 1 into the angiotensin 2. This angiotensin 2 is act on different types of cells present in our body, and by acting on the different types of cell, it will produce a different physiological actions. So angiotensin 2 act on a angiotensin 2 receptor. When it binds to the angiotensin 2 receptor in a target cells, the target cells are many. It may be blood vessel, it may be activation of sympathetic activities, it may activate your aldosterone. So by binding to the target cells, it increases the synaptic outflow, increases the vasoconstriction of blood vessels, and causes the release of aldosterone. Ultimately, all these things increases the blood pressure and thereby they are increasing the blood pressure, and this is the normal mechanism of renin-angiotensin system. So our drugs like a ACE inhibitor act on the enzyme is angiotensin converting enzyme present in the lungs, and thereby blocks it, and thereby decreasing the formation of angiotensin second. The ACE inhibitors are ends with a prils, captopril, enalapril, lisinopril, and so on. The mechanism of action is what? They are blocking just the enzyme, that is the angiotensin converting enzyme, thereby inhibiting the formation of angiotensin second, and by inhibiting the formation of angiotensin second, it will not going to bind on the target cell, and thereby decreases the blood pressure. Side effects includes dry cough, rashes, skin rash, nausea and vomiting. Sometimes it produces diarrhea, angioedema and light headache. So these drugs are contraindicated in mainly pregnancy, asthma, a chronic cough, allergy, and kidney diseases like what your renal stenosis. Next class of drug is what your angiotensin receptor blockers. These angiotensin receptor blockers directly act on the angiotensin receptor. They competitively block the angiotensin receptor, thereby inhibiting the binding of angiotensin second to the angiotensin receptor, and thereby reduces the blood pressure by decreasing the synaptic outflow, by decreasing the vasoconstriction, and by inhibiting the release of aldosterone. The side effects includes light headache, nausea, vomiting, dizziness, and some kind of shows the back pain. These drugs are also contraindicated in pregnancy, then renal stenosis and allergy. The angiotensin second receptor blockers are much more efficient as compared to angiotensin converting enzyme inhibitors, as they do not produce a dry cough and all. So these drugs are very beneficial to treat in the patients suffering from asthma. These angiotensin second receptor blockers are ends with sultans. Losartan, valsartan, condensartan, telmisartan. These are some few examples of this class. Next class of drugs, that is what your alpha receptor blockers. For understanding that, we just zoom out the blood vessel. So blood vessels are showing the lumen, and they are surrounded by these smooth muscle cells. The lumen of the blood vessel shows the endothelial cells, which are indicated by the red color. The smooth muscle cells play a very important role. If the smooth muscle cell contract, it causes the narrowing of the lumen, that is called vasoconstriction. And when the smooth muscles surrounding the blood vessels relax, this causes the widening of the lumen, that is nothing but the vasodilation. So as the smooth muscle contract, it causes narrowing of the lumen, increases the blood pressure, and when smooth muscle relax, it causes the vasodilation. So smooth muscles are surrounded by the alpha 1 receptor, and alpha 1 receptors are get activated when there is a supply of non-adrenaline and adrenaline from the adrenergic neurons. So yellow color indicating adrenergic neurons. The adrenergic neurons are released by the adrenal, that releases the adrenaline and non-adrenaline. By binding the non-adrenaline and adrenaline to the alpha 1 receptor, that causes the contraction of the blood vessel, contraction of the smooth muscle. The smooth muscle contraction lead to the vasoconstriction, and thereby increases the blood pressure. So alpha 1 receptor blockers are the drugs that directly block the alpha 1 receptor and inhibit the activity of what your adrenaline and non-adrenaline, and thereby decreases the blood pressure. So mode of action is what? They inhibits the adrenergic activity at the smooth muscles, and thereby decreases the blood pressure. They also decreases the total cholesterol level, and hence they are useful in the peoples who are having a hypertension as well as high cholesterol. These side effects includes the hypotension. So this is all about the alpha receptor blockers. Alpha receptor blockers. Examples of this is prazosin, trazosine. So next class of drugs, that is beta blockers. Let's start with the B. Beta blockers. Beta blockers are end with a lol. Metoprolol, atenolol, propranolol, and many more. So before starting the beta blockers, so beta blockers are basically two types, non-selective beta blockers and the selective beta blockers. The non-selective beta blockers are bind to the beta 1 as well as beta 2 receptor, and the selective beta blockers are bind on only beta 1 receptor that are located on the heart. And second class that are your non-selective beta blockers. The non-selective beta blockers are work on the heart as well as on the other tissues, so thereby they produce side effects. So let's just focus on the heart first. So heart, right atrium of the heart is showing a pacemaker cells. These pacemaker cells are responsible for maintaining the heart rate. The pacemaker cells includes the SA node and the AV node. Both the SA node and the AV nodes are supplied with beta receptors, and activity of the heart that is regulated by the sympathetic as well as parasympathetic nervous system. The pacemaker cells shows the beta 1 receptors on their body, and the beta 1 receptors are get activated by the sympathetic nervous system through the adrenergic neurons. Adrenergic neurons releases the neurotransmitter like what your non-adrenaline and adrenaline. Non-adrenaline and adrenaline bind to the beta 1 receptor located on the pacemaker cells, and thereby increases the heart rate. Increases the heart rate, indirectly increases the blood pressure. Already we discussed in last lecture. Also, we know the heart is made up of a special type of muscle cells. We call them as the cardiac muscle cells. These cardiac muscle cells shows the presence of receptors, that is beta 1 receptors are located on the cardiac muscle cells. These adrenaline and non-adrenaline, by acting on the beta receptor on the cardiac muscle cells, produces the forceful contraction of the cardiac muscles. By the forceful contraction, it directly increases the stroke volume, thereby increases the cardiac output, and increasing the cardiac output directly and indirectly increases the blood pressure. So in this way, in normal condition, adrenaline and non-adrenaline undergo responsible for increasing the force of contraction of the heart and increasing the blood pressure. So beta blockers are bind on the beta receptors and block the activity of the non-adrenaline and adrenaline. So mode of action of beta blockers is what? They blocks the sympathetic function of the heart by blocking the beta receptors on the heart. They produces the action by two ways: decreases the heart rate, thereby decreases the cardiac output and decreases the blood pressure. Secondly, they decreases the myocardial contraction by decreasing the cardiac output and thereby decreases the blood pressure. Side effects includes bradycardia, fatigue, hypotension, decreasing the libido, impotency, and bronchoconstriction. Contraindications: they are contraindicated in obstructive lung diseases, then peripheral vascular disease and Prinzmetal angina. Beta blockers. Moving to the next class of the drugs, that is what here C type, that is calcium channel blockers. Calcium channel blockers are ends with many suffixes, that is most commonly is pril, verapamil, then ipins, that is nifedipine and amlodipine. So calcium channel blockers are of two types, that is what your T type and or L type of calcium channel. So calcium channel blockers are blocking the T type channel or L type channel and thereby decreasing the blood pressure. How they works, we will see. The L type calcium channel blockers, and second is what your T type calcium channel blocker. First we talk about the T type calcium channel blockers. So T type of calcium channel blockers are found in the pacemaker cells. Over the pacemaker cells, there is a presence of what here ion channel, that is for calcium channel. So calcium channel, when allows the entry of calcium ion inside the pacemaker cell, this will causes the increase in the force activity of the pacemaker cell, thereby increases the heart rate, thereby increases the blood pressure. So the calcium channel blockers blocks the T type of calcium channels on the pacemaker cell, thereby decreasing the entry of calcium ion inside the pacemaker cell and decreases the heart rate and the blood pressure. So they decreases the heart rate by decreasing the force of contraction produced by the pacemaker cell, thereby decreases the cardiac output and thereby decreases the blood pressure. If we talk about the calcium channel blockers, there are three types as far as the chemical nature is concerned. Phenyl alkylanes, verapamil is the example, benzodiazepines, diltiazepam is the example, and dihydropyridines, amlodipine and nifedipine, these are the two examples. So calcium channel blockers, for example, you can talk about the verapamil, that is going to block the calcium channel in the pacemaker cell and thereby decreasing the force of contraction of the heart. So here the verapamil, it will bind to the calcium channel and blocks the entry of calcium in the pacemaker cell and thereby they producing their effect. So this is all about the T type of calcium channel blockers. They are helpful for decreasing the blood pressure by decreasing the heart rate. So next type of calcium channel blocker is a L type. Here we zoom out the blood vessel because L type of calcium channel blockers are present on the smooth muscles of the blood vessels. L type of calcium channel blockers are present on the smooth muscles. By entry of the calcium ion inside the muscle, it causes a contraction of the blood vessel, and blood vessel contraction lead to the vasoconstriction and thereby increases the blood pressure. Also, this L type of calcium channel blockers are also found in the cardiomyocyte cells and thereby causes a contraction of the blood, contraction of the muscles of the heart and thereby increases the blood pressure. So the calcium channel blockers will going to block the calcium entry inside the smooth muscles in the blood vessels, thereby decreasing the force of contraction, thereby decreasing the vasoconstriction in the blood vessels and thereby causes the vasodilation. By doing the vasodilation in the blood vessels, they decreases the peripheral resistance and thereby they will going to reduce the blood pressure. The best example for this is nifedipine. The side effects includes what here: flushing, headache, dizziness, hypotension, palpitation, and peripheral edema. These drugs are mainly contraindicated in the congestive heart failure because in the congestive heart failure already the heart is weak, force of contraction is already low. If you use the calcium type channel blockers, the calcium channel blockers will also going to increase the force of contraction and this may causes the heart failure and this may lead to the death of the person. That's why the calcium channel blockers are not used when there is a heart failure or congestive heart failure. So this is all about the calcium channel blockers. So next class of drug is diuretics. We know the diuretics are acting on your kidneys. The functional unit of the kidney we call it as a nephron, which is responsible for formation of urine. The diuretics are the drugs that increases the urine output and thereby decreasing the fluid overload and thereby decreasing the blood pressure. The diuretics are mainly act on the different parts of the kidney, nephron. The diuretics, so we just draw here the one blood vessel, that is a vein, that is collecting the water along with the sodium ions. So mode of action of the diuretics, that increases the urine output, that decreases the fluid overload and thereby that decreases the blood pressure. There are three types of diuretics. One of them is a loop diuretic, that is called the strong diuretic. Furosemide is the example. Second class is what your thiazide diuretics. The example is what your hydrochlorothiazide, and potassium sparing diuretic. The example is your spironolactone. The loop diuretics are mainly act on the loop of Henle. In the loop of Henle, there is one transporter is there which is responsible for reabsorption of sodium ion, 2 chlorides and 1 potassium ion. Along with the reabsorption of the sodium ion, the water is also reabsorbed into the blood, and thereby they increases the reabsorption of water. But the loop diuretics are act on this transport channel. They blocks the reabsorption of sodium ion, and by blocking the reabsorption of sodium ion, they will decreases the reabsorption of water and thereby increases the water loss into the urine, and thereby increases the urine output and decreases the blood pressure. A second class of drug, that is what your thiazides. Thiazides act on your DCT. In the DCT, there is a one channel is there that is responsible for reabsorption of sodium along with the chloride ion. Thiazide diuretics act on the DCT and PCD mostly, and at there they blocks this channel that is responsible for reabsorption of sodium. By inhibiting this channel, the sodium is not reabsorbed, it goes into the water, into the urine, and along with that the maximum water is reabsorbed. Maximum water loss is there. The third type of channel is also present on your DCT, on collecting tubule. At this channel, the potassium sparing diuretics are working. The potassium sparing diuretics inhibit the reabsorption of sodium and inhibit the entry of sodium into the urine. Means they are not allowing the exchange of sodium along with the potassium ion in the collecting tubule, thereby sparing means reducing the loss of potassium ion into the urine and increasing the loss of sodium ion into the urine. Why increasing the sodium loss? There is a more amount of water is also lost, and this increases the urine output, and thereby that decreases the blood pressure. Side effects of the loop diuretics and the thiazide diuretics includes hypokalemia, hyponatremia, and hypovolemia, and hypotension. And lastly, it causes hyperuremia, that is increases the risk of what your hyperuremia, that is increases the risk of what your gout. Hypoglycemia, metabolic alkalosis, and pancreatitis, these are also some side effects. Potassium sparing diuretics are producing a side effects like what your increasing the levels of potassium ion, that is a hyperkalemia, metabolic acidosis, and gynecomastia in the, that is enlargement of breast in the males. Moving to the last class of the drugs, that is what your endothelial receptor antagonist, E, that is the endothelin receptor antagonist, So these drugs are act on what your blood vessel lumen. Blood vessel of the lumen consists of what your smooth muscles. On the smooth muscle there is a presence of endothelin receptors. Normally the blood vessels, in the blood there is a production of what your endothelin 1. This endothelin 1 act on the endothelin receptors and produces the contraction of smooth muscle and thereby increases the blood pressure. This endothelin receptor antagonist bind on the endothelin receptor and blocks the action of endothelin on the receptor, and thereby produces what? Vasodilation by inhibiting the vasoconstriction. And as vasodilation is there, that increases the blood pressure. That decreases the blood pressure. Side effect includes headache, peripheral edema, nasal congestion, nausea, hypotension, and palpitation. So this is all about the antihypertensive drugs. Thank you very much.